Good morning, everyone. My name is Kate, as you know, and this is my leadership skills blog post. Upon completing the leadership skills questionnaire, I kind of found that all my categories had similar scores. However, my actual interpersonal skills was a little bit higher of a score. It kind of fell into the high range, but just barely, whereas the other two fell into moderate. When it comes to the scores being kind of similar, I feel like this shows a balance in between all my leadership skills. So I feel like eventually maybe it'll make me a decent manager or clinical nurse educator in the setting. Um, it did surprise me that my interpersonal was a little bit higher than the other two, as of I'm just more timid to take an administrative role or a conceptual role, because even though I'm a pretty ideal oriented person and I'm just a very driven, determined person, I'm always scared to share my ideas, especially when it comes to things at work such as projects and things like the coalitions and things. I'm trying to get involved in the coalition, just to get more involved in our unit and in the hospital-wide system. But it's just difficult for me to take that step, but I'm determined to take that step next week at our first meeting. When it comes to how our organizational structure is in our hospital, we have a very horizontal health system structure. When it comes to each individual unit, we have 5 adult ICUs and 2 pediatric ICUs, a pediatric ICU and a neonatal ICU. Every one of these ICUs report to their individual manager, who then reports to an assistant ICU specialty manager. In between those, there's a pediatric and then there's an adult. Those two then report to the ICU specialty manager, who then reports on up the line all the way up to the vice president of nursing, CEO, etc., board. However, my personal opinion with the horizontal system, I feel like it gives you more options as to who to go to whenever something's going wrong and you feel like something's not being fixed like it should be. However, it kind of has a drop off to me. I've worked here at this hospital for about 10 months. And I cannot personally tell you the names of anybody above the adult ICU assistant manager that takes care of the 5 adult ICUs. Past that role, all the people in between her position and the vice president of nursing is completely lost to me. I know there's more than one vice president of nursing, so the senior vice president of nursing, I know her name, as I have met her personally. But there's 2 or 3 others that take roles, and then there's a clinical nurse liaison who works with our senior vice president to try to filter out some of the things that she gets. And there's just kind of a discourse in between the staff knowing them and them knowing who we are, because I actually worked last night and discussed this with fellow nurses, and not one of us could actually name one of these people. So I feel like that could be a big issue with the horizontal health system structures in huge hospitals. I know it's pretty typical, as it's the easiest way to manage a large hospital, but at the same time, it just creates that kind of disconnect, I feel like. When it comes to skills of a manager, as described in chapter 7 of our textbook, what would I personally feel like I was a manager in one of these health systems? I would feel like I would have to really collaborate between the adult assistant manager as well as the overall ICU specialty manager to kind of figure out what the administrative side of nursing would like, and maybe even try to help ease that discourse between the two. I would also like to collaborate between other fields, like the manager of our respiratory therapy department, radiology department, etc., to ensure that the needs of the units not changed, but met whenever needed. I know our manager is really, really good about this. She's works with the other managers in the ICU. If there's staffing issues, the 5 units try to work together to say, hey, I've got an extra nurse. You're lacking 2 nurses. Maybe I can give you a nurse tonight or today to kind of help out with your staffing. RT is excellent about their role. If we've got if we've got a unit full of 14 vents, they will work together with their manager, and our manager to try to figure out a solution to make sure everybody's taken care of. I've seen our manager collaborate with the radiology manager to try to get people into CAT scans sooner for emergencies, etc. When it comes to the actual skills, I feel like they all can kind of fit into the realm of trying to secure the needs and resources, such as staff for the unit. But I'm going to kind of emphasize just on a couple. I feel like planning is a huge part of being a nurse manager and having like a skill that a nurse manager needs, because I feel like if you're not planning and you're not organizing things, everything in your unit is going to fall apart. For example, the planning, our manager is excellent about having huddles and meetings and things about meeting staffing needs and what products is on back order and what we need to work on throughout the unit. And I feel like that's a skill that I would need to be a manager. And it's a skill I feel like that takes time to master. As well as organizing. I know our book goes into something called horizontal differentiation. It's to basically separate activities into more individualized people. For example, I feel like in our unit we have a great kind of example of this. Our manager has delegated like the resources such as equipment and patients' room stocking and things like that to the CNAs. So that's something that they do, whereas like staffing has been delegated to 2 different nurses. One nurse does day staffing, one nurse does night staffing, so that it's not all on the manager. I feel like this delegating and organizing is what makes a good manager, because taking the weight of the world on your shoulder is something that you need to kind of get away from when you're a manager, because you have so many things to deal with, especially on the administrative side. So the help and the delegation, I think, is excellent for a manager. Dealing with staffing to me would be a nightmare, so that's one of the other skills I'm going to cover, because I feel like this is a skill that also comes with time, that is done excellently by some and not so excellently by others. Staffing is basically defined as deciding the type and the number of nurses, CNAs, etc. needed to fill the roles of your unit for the needs of the patients. Once again, our manager does great at this. She tries to make sure we always have the nurses that we need. So I kind of aspire to be like her if I ever fall into a management role. And lastly, coordination. I feel like this is a big thing that goes on with the organizing and the delegating. If people are not coordinating together, if the manager and the assistants, specialty managers, like all the way up through administration, are not coordinating together to meet hospital needs, etc., I feel like everything just kind of falls apart. And therefore, that's also an essential skill. And to incorporate published literature, I think, is extremely essential, because incorporating evidence-based practice into everything we do as a nurse is essential. We want to do the best we can for our patients as well as our staff. I found an excellent article that is entitled Transdisciplinary coordination and delivery of care. It is a article that I found in Seminars in Oncology Nursing by Scarlett Mueller. Basically, it just goes over disciplinary care models within the oncology setting, especially since it has been affected by the Affordable Care Act. It goes over things such as the oncology care model, which has come out in 2016 to help especially people in rural settings like Colorado, North Dakota, things where they're having to drive 50 miles plus to get to an actual physician, and how we can kind of use transdisciplinary models in those cases to help these patients out. For example, using these models can help with patient navigation. It involves things such as in-home care, respiratory care, care planning, patient access to 24/7 clinicians over the phone or through something like Skype, treatment regimens that follow national guidelines, and other things. So I enjoyed the article and seeing how the models can really affect our patients, because I feel like that's the number one thing that we need to think about is how our transdisciplinary care models, especially with our hospitals and then our rural patients, affect them and how their care is going. I hope to hear what everybody else has to say on this blog, and everybody have a great day.